throughout his political career, including Blue Cross Blue Shield of North Dakota, which we know is now deeply corrupt and has tremendous amount of corporate waste. As we mentioned the last time we talked, he voted twice against a public option in the Senate Finance Committee. We think he did a great thing yesterday, voting for a healthcare reform bill in the Finance Committee, but we need his vote for a public option when the vote comes to the Senate floor. Healthcare reform with a public health insurance option is good for North Dakota families. Including a robust public option in healthcare reform would cover 78% of the currently uninsured and save North Dakota hospitals at least $37.5 million annually in uncompensated care. Senator Conrad needs to stand for a robust public option, not half measures like the co-ops or the trigger. He claims that the co-ops are a viable alternative, but that's just flat out wrong. We've seen all the corporate waste scandals and rate raising out of the blues here in North Dakota, which closely resemble the co-ops he is pushing. We're asking Senator Conrad to return all of the campaign contributions he's ever received from Blue Cross Blue Shield of North Dakota in light of the waste and corruption recently unearthed by the state insurance commissioner. It's time for Senator Conrad to put his constituents' health before the interests of the health insurance industry. And so you've heard our message. We'd like to present the check to you and make our message that there are doctors, small business owners, and citizens right here in North Dakota who desperately need a health care bill that includes a strong public option. Yeah.
Scott, the check is yours. You can send it on to Mr. Conrad.
All right, well, thank you for your time today.
Welcome.
And I know you'll pass on what we've said here to Senator Conrad.
Very well.
Thank you very much.
I had one idea too, where we could have a public option that the students in North Dakota could run through grant money to the state, rather than having all our brain power leave. Keep the students who run the public option.
Me. The station of me.
I'm kind of allowed for that too.
Who you work for?
I'd like
got
to say
question.
122.
Which hospitals would be jeopardized with the Medicare rates? Which hospitals would go out of business
or
because of the
swine
Medicare?
flu or anything like that, you'd be all over it. Senator Conrad would be all over it. So
You understand that the health care reform measure that passed covers a large portion of our uninsured population. You know that, and you also know when you compare that to the House version that includes a public option, this bill covers substantially more people.
actually, I
the
believe it's
uninsured
about
people.
half,
Substantially
25
more.
compared to 47 million.
No, 47 million is not in the House bill.
But it's an option that covers all people that are uninsured.
All people are covered by
Qualifies.
both bills.
No, they're not.
Yes, well, in terms of eligibility, yes.
Yeah, but in terms of people having insurance available to them.
Which,
Factually, a lot of people aren't able to get insurance.
yes, we understand that, and that's why we're doing everything we can to provide insurance to the uninsured.
I think you could do more.
I understand how you feel. All right, thank you.
Public libraries work. I think public option would also work great.
Well, what hospitals go out of business because of Medicare reimbursements and rates and that?
Public libraries.
Senator Conrad will issue a statement.
He knows that?
Public libraries.
Does he know which hospitals are
Well, you
like
can
jeopardized?
ask the hospitals. They're the ones telling us that.
I'd like
Oh,
to know what his plans are for preventative care, because I know the doctors don't learn that in school. They don't learn about how to maintain health. They only learn how to detect disease and treat it with drugs or surgery or like that.
Incentives in the finance committee package for that help.
That worked for you.
And is it going to allow the people who have actually studied it, like acupuncturists, naturopaths, homeopaths, herbalists?
Nobody's got that included in their bill.
Well, it needs to
Public
be.
option doesn't include it.
Well, that doesn't mean there's a. I mean, it needs to be. Those are the only guys that know about
Well, I
it.
understand how you feel, but none of that is covered. No. homeopathic medicine is not something that's covered. You know,
Because the AMA has got the monopoly. Allopathic medicine.
I know, but that's a fight that's not in this debate right
Well,
now.
it needs to be.
Okay.
That's my message. It needs to be. My daughter's an acupuncturist, and when she went to school in California, acupuncturists are trained like physicians, and they are saving a heck of a lot of money. When we talk on the phone, she's in Portland, Oregon now. I mean, she tells me these miracle stories every time we talk. I mean, it's just incredible how much money could be saved if we were really practicing prevention. Because what's being called preventative now is not going to be it. It's just a name put on something.
Healthcare insurance industry,
Or
right?
whatever options, additional options have become created, yes.
For
It
disease
doesn't,
management,
it is
not
for
health
you
care.
though, it is for your health insurance. Right?
But it goes right into the private
Well-
coffers. And isn't that what that woman was talking about, the Price Waterhouse study that said that insurance, she was the CEO, Ignatia, something like that? As far as I'm concerned, what she was talking about was extortion. If you don't give us the money, the subsidized money for those health insurance policies, we are going to make it so difficult.
Now, what they were saying in that study is that when they ran their own numbers, that the problem is because if you make, if you don't have a strong requirement to purchase insurance, and you couple that with no limit on pre-existing conditions, they will have a huge problem with adverse selection. People not going to get insurance until they're sick.
Well,
And that's
what
their
they're
issue.
doing right now.
No, they unfortunately right now they don't let you get insurance because
No,
there's
no.
pre-existing conditions. to keep
People
you
are
out.
waiting until they get so sick that they have to go to an emergency room. But I could go for not a public option if the money that was paid in subsidy was not going right into the pockets. Another good, just gusher up. Just like we did with the banks.
I understand your position. You explained it to me before, Mary, and I appreciate where you're coming from. It's not. Let me just say that all of the people that are here today are in this debate for all the right reasons. You're very passionate. You care deeply about all the other people out there that don't have insurance, or friends and neighbors of yours that don't have it.
Or myself.
I understand that, and so does Senator Conrad. We're trying to get a bill that covers people that don't have insurance. I know you have a difference of opinion on some aspects of this bill, but the goals that we have are all shared. We're not on a different plane in terms of whether we get people insured or not, whether or not we provide insurance to the uninsured, whether we make it more available or less costly. Those are all the same goals Senator Conrad shares.
The
You
difference
understand that?
is, to whom does the money go?
And what kind of care is it going for? If it's not going for something that's really health care, instead of, I mean, what's being called health care now is
I understand
a
your position on
euphemism.
that,
It just
but,
isn't.
but
I have not been sick my entire adult life because I've had alternative care, which I've paid for myself. And it's been
my
treated
mother
well.
is no different than you. She goes to those same kind of care providers, and she's very successful with it.
So,
But-
do you see how important it is to make it available
And when you,
to
and every
people?
time you add another provider eligibility program, you know, the estimation of costs do go up. And
But if
that's,
they're gonna be doing some good.
whether or not,
Why not
whether or not
scratch
we
all
can
the others
prove
that are
this is how
there?
they score it in Washington DC. And we don't control the scoring, you don't control the scoring, my mom doesn't control the
Who does
scoring.
control the scoring?
Congressional Budget Office. Congressional Budget Office is a score.
No, the budget office, no,
Right?
it's not people that are wanting.
I want to say something.